Since 1942, the veterans in Southern Illinois and Northern Kentucky have been lucky. They've had the Marion Veterans Affairs Medical Center, the Marion VA as we call it, one of the best hospitals and clinics in America that services these families and their needs. But unfortunately, they ran into a serious problem. A higher death rate than expected between October of 2006 and March 2007 led to an investigation of the surgical facilities at this VA hospital by the Inspector General. His report, unfortunately, identified 9 deaths directly attributable to substandard care, medical malpractice, and 34 cases where care complicated the patient's health. At that point, the VA said, stop. We need to remove the hospital director, the chief of staff, the chief of surgery, and an anesthesiologist from their positions, and one surgeon was fired. So in 2009, I introduced a bill, and I said we have to make sure we improve the quality of care at the VA medical facilities and help recruit highly qualified doctors to serve in these positions that have been vacated. Most of that bill is now law, and Marion VA Center has really improved. Its background checks, credentialing, and privileging processes are really making certain that we get high-quality individuals to fill these vacancies. We've increased staff support, on-site credentialing, privileging services, and recently Marion was identified as using the best practices in looking for new doctors and judging doctors by the Joint Commission. Fixing the problems at Marion has been the focus of mine for a long time because I know that there are great men and women who continue to work there throughout this controversy, and my hat's off to them for serving veterans and their families so well, so professionally, for so long. After several years of hard work by the employees at Marion, we are now ready to provide standard-level, low-risk inpatient surgery again. In December of last year, the Marion VA was fully accredited by the Joint Commissions. Veterans and Congress expect the Marion facility and the VA at large will provide proper oversight and ensure quality care. Resuming inpatient surgery at Marion is going to improve convenience and quality of care for Southern Illinois veterans, saving them from driving hundreds of miles in some cases. Marion's employees are working hard to do the right thing, and they're going to continue to rise to the challenge as they resume inpatient surgery and provide the finest, most professional medical care for veterans and their families in Southern Illinois.